Good evening, Ron A., committeeman for C1 here in the Heights. Mr. Kelly, thank you for coming today and giving your time to address the community. I just have one question, and sort of been reiterated a little bit prior. The process in selecting Prime, is there any way you can discuss what the process was and if there were any alternatives that were discussed that were more advantageous for the community or anything to that effect?
Mr. Ross, I've made it clear in previous meetings we did not go through what is called a formal RFP process where we sent out a notice to the world and said, are you interested in buying Christ Hospital? And there's a reason why we didn't do that, because we felt over the last 3 years in particular, and I think I might have mentioned in my opening comments, that we have made very, very focused and concerted efforts with what we believe were appropriate and legitimate, and I think Hackensack University Medical Center, St. Barnabas Healthcare System, the state support, the potential combination with Hoboken were legitimate approaches to look at legitimate options. And the problem in the not-for-profit sector today is that not-for-profit institutions and systems do not have the resources or are not willing to make the investments. So, and you know, we were very involved in terms of being aware of the bidders that came to Hoboken. And a number of those individuals, even without solicitation, reached out to us. But I think the important difference that we felt was that, and I've said this before, Prime is not an investment banker. They're not venture capitalists. They run hospitals. And I think that's a very, very important difference. And it's one of the major reasons why we felt very strongly that this was the right fit. To the state, in the CHAPA application to the Attorney General, it is stated there that Christ Hospital, after being acquired by Prime, will provide, at a minimum, the same level of charity care services that we have provided historically, and in complete compliance with what state requirements are. Because if you don't provide charity care services, the state is not going to reimburse you partly for those services, but more importantly, as part of the licensure process, they will insist, the state will insist that those services be provided. So people need to understand that the state will have a very, very big hand, as they do in Hoboken, as they do in Meadowlands, and as they do in Bayonne.
Thank you very much.